Good morning. Thanks as always to Jay and Vicki for interpreting this morning. Going to get right to the numbers. This is our last briefing of the year, excuse me, and so we're going to put some of these numbers in perspective for you. So the number of cases, positive cases in Hamilton County is at 50,527. The number of hospitalizations in Hamilton County is up to 2,064, and the number of deaths for Hamilton County is at 411. The increases from last week in positive cases is 2,814, hospitalizations is 64, and deaths is 3. Those numbers are trending down, and Greg is going to talk a little bit about that. So as we prepare to enter a new year, I want to highlight a text that I saw that went out from Hamilton County Public Health saying, let's leave 2020 in 2020. But before we do that, I think it's worth remembering the toll that COVID-19 has taken on our community, especially Hamilton County this year. So roughly 1 in 16 people in Hamilton County have had COVID-19. 1 in 16. That number really struck me. Many have recovered, but 411 to date have paid the ultimate price, and over 2,000 of our neighbors were hospitalized with COVID-19. Our economy came to a standstill, businesses shut down, classrooms closed, jobs were lost, families made sacrifices to keep loved ones safe and sound, healthcare workers risked their lives to save others. Frontline workers did the same. Nationally, we are hearing that as we enter 2021, things are going to get worse. Cases are up, the virus is going to continue to spread, and more people will die. All of this as we look forward to widespread vaccination in the coming year, in 2021. Vaccines are here. They're in this community with more and more people getting them every day. As you recall, the healthcare workers are getting them and our first responders are getting them. So there's hope. And I was asked the other day, by the way, about my optimism about such things. As the vaccine rolls out, albeit slowly, but we're going to get there. And why I continue to be rather optimistic about how Hamilton County is doing, even though we have some grim numbers. But we all have the tools we need to reduce the spread and keep ourselves safe. And so that gives me optimism, right? We all can wear a mask, we all can stay away from one another, we can all wash our hands and reduce our COVID footprint. So my optimism, I think, comes from the idea that we all have the power individually to do what we need to do to keep ourselves and other people safe. And so we just need to practice these safe practices until we all get vaccinated in 2021. And speaking of the reduction of the COVID footprint, we need to be extra diligent this New Year's Eve. We have one more holiday to go here in 2020. And so this means skipping unsafe parties or gatherings and limiting our COVID footprint. It means coming up with new and safe ways to ring in the new year. We did not see a significant spike after Thanksgiving. It is too early to tell if that will be the case after Christmas. We've got a little ways to go here. I don't know that there's so much optimism actually about Christmas, but we've got one more, which is New Year's. And I think it's easier to restrict our celebrations at New Year's because they're not traditionally as sentimental as the other two when it comes to our families and the loved ones, especially the older loved ones in our families. So there are a couple suggestions that we pulled down from the CDC website about New Year's Eve and how to ring in the new year. Have a virtual celebration with loved ones, attend a virtual concert or performance, plan a virtual countdown to midnight with friends and family, enjoy a virtual dinner or dessert with family and friends, plan a New Year's party for the people that you live with, decorate, play music, have a dance party. Jay, I don't know if you dance. I suspect that you do, but I would love to see Jay's dance party. With the people that you live with, or have a pajama party and watch your favorite movies. Plan a special meal or dessert with your family. And reach out to family and friends and neighbors. Call, text, do a Zoom, leave a voicemail for family and friends wishing them a Happy New Year. Call friends and family to count down and plan a neighborhood countdown to midnight out on the front porch. We used to do this when we were kids. I don't know if people still do this. We used to, there were 8 of us, so we didn't all have streamers and all that stuff. We had pots and pans, and so we used to take ladles and bang pots and pans at New Year's. So I know it's a bit of a throwback, but that's something people could do. So these are just a few suggestions for playing it safe. So let's leave 2020 and 2020 and enter 2021 with a renewed sense of purpose, a heightened sense of confidence, and a commitment to take the steps to put this virus behind us in 2021. With that, I'm going to turn it over to Hamilton County Health Commissioner Greg Kesterman.
Thank you, Commissioner Driehaus, and good morning. Over the last several weeks, we have continued to see a decrease in the number of new daily cases of COVID-19. And I do want to reiterate that this decline is promising, and I'm excited to see us continue to trend in the right direction with regards to cases. I'm also excited to report that thanks to the continuation of federal funding, the Test and Protect program will be able to continue here in Hamilton County throughout 2021. So if you need access to testing, there are lots of opportunities throughout Hamilton County, and there is pretty much no wait to get tested, and test results are coming back in less than 48 hours. It's a great opportunity funded by Hamilton County Commissioners, and I'm happy to have such great access in Hamilton County. I would actually suggest that we have the best access to testing anywhere in the state of Ohio. Looking closely at our numbers here in Hamilton County, you can see we are starting to have a nice sharp decline in overall cases. Since December 10th, our daily case totals have declined, so that's very promising. They remain still at a very elevated level. However, we are now officially seeing this come down, which is perfect. On average, over the last 7 days, we saw 380 cases over the last week per day, so 380. When you compare that to 3 weeks ago, we were at 716, so a pretty dramatic decrease in the overall numbers of cases. While this is great news, I want to remind everyone there remains a lot of COVID-19 within our community. There are 19,500 known cases of active COVID-19 within our community, so there is still a lot of opportunity to get sick if we're not being careful. I share this as a reminder that when we're thinking about New Year's Eve and other events, I think it's really important that we continue to be vigilant and to do those social distancing, hand washing, keep sick at home, hand hygiene tools that we have talked about throughout the pandemic. Looking at our reproductive number, this number also is positive, or looks good, and this is very much closely tied to cases, and with our cases dropping, our reproductive number is now, for Hamilton County, 0.76. So a nice decrease below 1, which is also promising. When you look at the region, we are at 0.80. So we'll continue to watch that, and that does mean things are starting to shrink as cases are coming down, so very positive. Hospitalizations for Hamilton County, which is the top graph that you're seeing, continue to be fairly steady. They are also on the decline, and they are between 5 and 10 per day over the last few weeks. So another promising indicator. What remains concerning is the overall capacity within our region's hospital systems. You've heard me talk about our 14 county region, and we share medical resources. These numbers remain around 750 people within our hospital systems, and it still is putting significant stress on our hospitals and the staff within our hospitals. Realize that this is a delayed indicator, so with cases just starting to come down a few weeks ago, it will take time to impact the numbers in our hospital systems. But I think this should be an important reminder that we don't have a lot of wiggle room. If we start to make some pretty significant mistakes now, and we start to see more people ending up in the hospital, we're already at a very high level. So we have to continue to be very cautious with our activities. When you look at the intensive care units, they are the same as they've been. We have about 175 patients within our regional intensive care units. While several metrics are looking positive, we are a long way away from recovery here in Hamilton County. As I mentioned, we as a community have to continue to be careful. Tomorrow is New Year's Eve, and please continue to make adjustments to your plans. Celebrate the close of 2020 in a way that will let us continue to leave the pandemic of 2020 behind us. We want to be able to look to the future and come up with a new way to look at 2021, where we can be happy that we made it through 2020 and celebrate successes. As I shared last week, our agency is continuing to play a role in the vaccine delivery. We were successful at delivering to fire departments around the county. Many of their workers have received their first doses of vaccine, which is exciting news. These are people that have so graciously given to our communities, and we're happy that they are the first folks to get vaccinated. We'll continue to work through Tier 1A as vaccine arrives. It will be public health doing some of the work, but our hospital systems, pharmacies, and many, many other partners will play a role. The governor indicated that Tier 1A will be healthcare workers as well as those living in long-term care. So these are the most at-risk populations, and so we'll work through them as vaccine is delivered in Ohio. Even with vaccines occurring in Hamilton County, the tools that we have most readily available have remained the same. Please social distance, please wash your hands, and please wear a mask when you're out and about. Together we can beat this, only together. Thank you.
Thank you, Greg. Bridget, I believe we're ready for questions.
Larry Seward from WCPO has questions for both commissioners.
Okay.
Good morning. Commissioner Driehaus, first, the stimulus approved by or signed by the president, where will Hamilton County taxpayers see the impact most quickly, and what departments are most in need of that assistance?
So there are two different buckets here that I'm going to talk about. One is the federal help and the state help, and our understanding is that there are dollars for rent relief, there are dollars for small businesses, there are dollars for individuals who are struggling, and so we are watching that closely to get a better understanding of how that will impact folks in Hamilton County. But the other piece that we were very concerned about was the dollars that we have left from the original $142 million from the federal government that we were going to lose had we not gotten an extension in that bill. So we did get the extension. So the Test and Protect program, remember we put $18 million behind that program, so that will continue into next year, and that's a huge deal. As Greg said, we've got fantastic access to testing in Hamilton County, really second to none in the state, so that will continue. And then we've got about 6 to 7 million that has kind of flowed to the bottom as other programs were pushed out into the community. We had a little bit of residual left, and so we are going to program those dollars and try to meet the need where the federal government and the state government have not met the need. And so more to come on that. We're kind of readjusting the budget to take a look at that and then decide how that 6 to 7 will be spent. But we have a few months to get that done. And so as we did before, we're going to try to hit those in this community who are struggling and not able to access some of the dollars and relief from the other levels of government.
What areas fall into that gap between the federal and state funding that you're looking at?
Well, that's, that's what we are looking at, right? To try to better, we just, it just passed, and so we're trying to understand, what that, we don't want to be redundant with our dollars. Let me give you an example. So when the federal government did the PPP program, if you'll recall, for businesses, many, many small businesses did not get those dollars because it was a first come, first serve. And so if you're not well banked, or you don't have an accountant on staff, or you don't have attorneys on staff, you did not get to the front of the line, and so you were left out. And so the county stepped in and said, all right, for those very small businesses, almost all of them were under 10 employees, we stepped in to say, if you didn't get those PPP dollars, or you got a small amount, we are going to step in and provide assistance to those really small businesses who are still struggling. So that's an example of what we're going to be looking at.
And for Greg, outside of Test and Protect, are there areas in the county's health care that need stimulus assistance?
At this time, I am not aware of any, but we will continue to monitor for that.
Thank you.
Next up, we have Corey Sharber with WVXU, and he has questions for you, Greg.
Good morning, Corey.
Good morning, Greg. Of course, this week we're seeing much lower numbers for COVID cases than in previous weeks. Are there trends that are showing why the numbers have decreased so much? And regarding testing, is it because less people are getting tested during this time than previous weeks, or is testing still about the same?
Great question. So we are continuing to see in Hamilton County very high levels of testing, and so we've not seen any major decreases. In fact, through the Test and Protect program over the last several months, we've increased the amount of testing within Hamilton County. Pretty much every single day of the week, with the exception of Christmas, I think you can actually go through that program and get a test. So the decreases that we are seeing are most likely truly attributed to people making adjustments in their behavior.
And just one more question. Now, of course, while cases have shown a decrease, there's still a lot of people hospitalized at the moment. There's only so much you can do in order to help out the hospitals, but how are hospitals coordinating right now to lower the strain?
The hospital systems are working as a region. This is something they have practiced and do routinely. And through regional coordination, they can do some load shifting, meaning if a hospital doesn't have the capacity, they can send patients elsewhere. Unfortunately, once you get to a certain level, it becomes very difficult to share patients because every hospital is kind of at their stretch point.
Thank you.
Brian Hamrick is up next from News 5.
Good morning, Brian.
Okay, trying to get unmuted there. How are you today?
Good to see you.
Good to see you. Just a couple of things. I know in terms of vaccine delivery, what are you hearing about numbers on the horizon, how much we might be getting, who might be getting what, those kind of numbers?
So from a high level perspective, the state has indicated that everyone right now should be vaccinating those in phase 1A, which are those healthcare workers and long-term care workers. So that's really what the hospital systems and the public health agencies that have gotten vaccine are kind of working through. For us here locally, we have worked as a region, and our hospital systems are taking care of themselves. So we as a region are starting with our EMS folks. As I indicated last week, about 1,100 doses went out to our fire departments to manage paramedics and EMS. From there, we start to work with nursing homes that are not covered under the federal program. And really how quick we go is in large part dependent upon how much vaccine we get. Last week, I reported Hamilton County Public Health got 1,800 doses. This week, we got 500 doses. And so we'll look to see each week what allocation we get, and then we'll go from there. Just because we got 500 doses, though, I don't think that's needs to be of concern. I think because long-term care are the state's highest priorities, they're getting large numbers of doses so they can work their way through 100% of the nursing homes, which have been hardest hit through this pandemic.
So those are going directly to those nursing homes then?
They are actually going directly to CVS and Walgreens through a federal program. The vaccine is allocated through the state of Ohio, so it's Ohio's doses, but going through this federal program to take care of those residents.
So in terms of numbers, how can we kind of even compare what we're getting this week to last week? Or, I mean, how do we even know what we're getting?
I believe there's a reporting dashboard at the state of Ohio's on coronavirus.ohio.gov.
And what are they telling you about how much of this vaccine is coming in and how much we're getting in the next couple of weeks?
So I am still a little unclear as to how much dosing Hamilton County Public Health is getting, but the reality is I am only one of many, many partners that will complete vaccination campaigns here in Hamilton County. All of the partners working together. Is there any indication that
anybody's getting any information on this, though?
We are looking to the state of Ohio, and I don't have a clear read at this time as to the number of doses.
Yeah, I mean, I think this is kind of part of the thing. One of my other reporters, I didn't read the statistic, but said that at the rate we're going now, there was some new information released. Again, I didn't read it, but something like we'll be 10 years getting everyone vaccinated at the rate we're going. Is there any level of pressure that can come from a county level or even a state level that you can be involved in to try and make the wheels turn faster?
I
Are we
honestly-
just at the mercy of what happens.
I honestly think, if you look at this, vaccine just became available, 12 days ago. I think as every agency is standing up and getting ready to make sure that we're appropriately supported, I'm actually very impressed with how well we're doing. I think over the next couple weeks there might be some bumps, but at the end of the day, I think we're prepared as a society to get vaccine into our community. Hamilton County Public Health in 2009 was successful at vaccinating 100,000 individuals for H1N1. And while it's a huge task and there were bumps and complications along the way, we stood up the necessary resources to do that. Back in 2009, the state relied heavily on public health to take on this load. This time the state knows that public health has been very taxed and we have many roles in this pandemic. And so the state this time is actually looking to many, many partners to get this job done. And so while there might be some sentiment that we're not doing it fast enough, I think we have to be fair to the professionals that are doing the work and realize that we're only in the first couple weeks.
You think it will progress faster as we get better at it?
Absolutely.
I just one other thing real quick. And when we've talked about frontline workers, healthcare workers, and I've talked to folks at some clinics, like the clinics where they're doing testing and places like this. Some of these folks still don't know when they're going to get this vaccine. Where are they on the priority list?
All of those individuals that are frontline healthcare workers, including the non-affiliated healthcare workers, so they're not affiliated with the hospital system, they would be phase 1A, and they might get vaccinated through a public health clinic that is open up just solely for them, or they might actually be included with a hospital system. Many of these individuals and locations have also registered through the state of Ohio as a pharmacy, so as a provider, and so they might actually see vaccine themselves. But the state is, as I mentioned, giving all the first vaccines to those in long-term care and starting to trickle through the rest of the process. So while folks are very desperate to get this vaccine because we know it's going to help protect Ohioans, I think there needs to be some patience.
I think part of the problem is just pure communication. I mean, in other words, you guys don't know. No one in the state knows. I mean, where does this information come from, and should somebody know?
At the end of the day, the state is relying upon the vaccine providers, Moderna and Pfizer, to allocate vaccine to Ohio. So the vaccine that we are getting really determines how much vaccine the state can give out to all these different programs. Ideally, on day one, there'd be enough vaccine to stand up clinics everywhere and to vaccinate all of Ohio, but that's not how vaccine rollout comes.
Right, well, hey, I appreciate you taking time out. Thanks a lot.
Next up, we have Ann Saker with the Inquirer, and she has questions for you, Greg.
Good morning, Ann.
Good morning, Greg. And to follow on Brian's line of questioning there, so no doubt, I know that you look at a lot of things every day, but no doubt you have seen coming out of the weekend and the early part of this week, there have been a lot of stories in the larger newspapers and larger news organizations that are criticizing the amount of vaccine that is getting out to the states from the federal government. And so from your experience and your view, what do you, A, did you see any of those? And B, what do you make of those?
I think this pandemic has worn our communities out, and it has really worn each of us out. And so the sooner we can get vaccine, the better. Ultimately, there's only so much vaccine available, and it takes time to produce. So I really truly believe all of the partners are doing the best that they can. The other thing that I think is important to look at is if there were probably 2 weeks of the year that are the worst weeks to roll a vaccine campaign program out, it would probably be the week of Christmas with 1.5 federal holidays and the week of New Year's with 1 federal holiday, because so many agencies are impacted. Many of us worked on Christmas. Many of us will work on New Year's Eve and New Year's Day to make sure that these programs are successful. But even with this effort, it's just a bad time of year to start a program like this. That said, we're happy. We're glad we can start the program. I'm so glad that we got vaccine last week and that our fire departments are getting vaccinated.
Okay. Thank you very much.
Liz Engel with the Business Courier has a question for you, Greg.
Good morning, Liz.
Morning. I'm curious, as we get into phases after this 1A, 1B, what that will look like in Hamilton County and how people will maybe sign up. How will they prove they belong in this phase? Do you have to show a pay stub? Kind of, if you guys have any thoughts on that yet.
So as we work through the phases, clearly early on while vaccine is limited, it will require a little bit more credentialing to make sure that the right folks are getting vaccine. As we open up into phase 1C, which is, I believe, everyone over the age of 65, we will have a lot more people coming to get vaccine, and we'll rely on many partners. Hamilton County Public Health is prepared to stand up drive-through clinics as well as clinics within gymnasiums or senior centers to get folks vaccinated. We will be scheduling people to get their vaccine. The last thing we want is 100,000 people showing up to get vaccine when we only have 1,000 doses available. So it'll be an orderly process in which people will know that if they show up today, they'll get the vaccine that they are planning to get.
Scheduling wise, are they calling? Is there an app? Is there a website?
We are going to be working with a company called ArmorVax, which has scheduling app and also a vaccine reminder, so it'll let you know where you can get your vaccine. That is still kind of in the early phases, and we're using it for some of these more smaller scale pods. But over the course of the next couple months, while we're getting ready for these larger clinics, we will be utilizing that to help push this information out.
What kind of credentialing, when you say credentialing, will be kind of required?
Fortunately, at this point, I could only speculate as we follow the state of Ohio's guidance. So, I would have to rely upon what the state tells me we're required to check. I suspect when we open things up to those older than 65, we'll be taking a quick look at someone's driver's license. When we talk about hospital systems and medical systems, we're working directly with the provider. And so we know who we're getting because we're talking to the business and they're sending their employees to us.
That's all I have. Thanks.
Thank you.
And that appears to conclude our questions from reporters.
Okay, great. Thank you. So I just want to highlight something relative to public health. So this will be our last briefing of 2020. And as you can see, COVID-19 didn't take a holiday, and neither did public health, and neither did we, and trying to provide information to this community. And so many others in this community have had to work through the holiday season, especially healthcare workers. And so our gratitude to them. And I want to thank the whole team behind the scenes as we have scrambled and to put up a way to communicate to people in this community towards the beginning of the year, and all of those who have worked to make these briefings happen. So when that pandemic hit, we knew we needed a different way to get critical information to the public, and our staff here at the county, along with the team at Resolve, and Jay and Vicki from Deaf Choice, stepped up to produce these briefings. So I want to thank them, and also thank the members of the media who have continued to cover these briefings and work to make sure that our citizens have crucial and often life-saving information. A special thanks to Health Commissioner Greg Kesterman for his hard work and dedication to protecting public health. Greg stepped into this role, as we might recall, as the Health Commissioner earlier this year, and has done an amazing job with the help of his team trying to keep our community safe. Thanks to those who have joined these briefings to provide important perspective and information regarding health disparities. Remember Renee Mahaffey-Harris, Commissioner Victoria Parks, Small Business Relief, Eric Kearney came in, rent assistance, we had Mark Lawson in related to that, impact to the hospitals with Dr. Lofgren, coordinated emergency response, we had Nick Crosley, our EMA director. Commissioner Summer Adumas joined us to talk about communications and messaging. So this has been a real collective effort of people in this community who have stepped up and said, I'm here to help. What can we do to keep people safe in this community? So I am just so grateful here as we wind up the end of the year to those behind the scenes and those in front of the camera for all that they've done and their willingness really to be part of the effort. So we will continue the briefings into next year. We're going to keep doing this until we don't have to. And I was just talking to Greg about this. Maybe mid-year in 2021, we'll stop having to do these briefings, and we all look forward to that. But until that time comes, we'll continue to do weekly briefings to keep people up to date and try to answer questions that you have and members of the community have. So we will be back here next week, and please, everyone, have a safe and sound Happy New Year. Thank you.